So why is Vertex significantly cutting their copay assistance program? This is lengthy. I'm going to put it all in one spot though, because I hate trying to find different parts of videos and going to try and hunt those down. I've said it before and I will say it again. If I make a mistake, I will correct it. This is all of the information currently right now that I have. I've done research to try my best to get this information out to you. It's a bit long, it's a bit confusing, so let's dive in. Also, yes, I have notes here, so I'll be glancing back and forth. So what is Vertex's current copay assistance program? I will show you this in a minute. Currently, Vertex's copay savings program lowers the monthly cost of Trikafta from an about $30,000 a month price tag with a copay of almost $8,000 or higher for some people. It lowers that to about $15 a month for eligible patients. Information about this copay assistance program is not found on their website, and they appear to be very tight-lipped about it from my own personal experience. Earlier this year, Vertex sent this email, which I'll show you in a moment. They sent it to people and they said, we're changing our current copay system, which I believe was an unlimited amount, but they were changing it to a maximum of $8,950 per month of copay costs. And I personally know several people whose copays exceed that amount. Before I get into the rest of the copay assistance program for 2023, I wanted to note this. It's very important. There's a study done, I hope I'm saying his name right, by Jonathan Guo, I believe is how you say it, called Current Prices versus Minimum Costs of Production for CFTR Modulators. It came out in September 2022, so this year. So in this study, he shows via this chart, which is from his study, that the costs of production for Trikafta and other CFTR drugs for cystic fibrosis that Vertex makes could be 90% lower than the current prices. So what does that mean? The cost of production is estimated from this study to be $6,000 a year. A year. Current prices for Trikafta are $311,000 or more per year. Additionally, the study notes that a generic production of the medication is feasible and it could be a solution, but yet Vertex has adamantly always fought back against this option. For example, in 2019, I heard about this company in Argentina trying to make Orkambi, which is another CFTR drug by Vertex. They had figured out how to make it a generic, and then I stopped hearing about it. Also, just wanted to quickly note this. It was an article done by Vertex's chief business officer, which stated that they bought this CF company and they eventually decided to only keep its cystic fibrosis program alive because of free funding it received from the CFF, which is the Cystic Fibrosis Foundation, which came without any demand for a future payoff and was a less expensive form of financing. So what is Vertex's copay assistance program changing to in 2023? January 1st, 2023, Vertex will be capping all of their assistance for every patient to $20,000 annually, and that is, again, only for eligible patients. Uninsured patients or patients who are not eligible to receive this get nothing. Vertex states that this $20,000 is, quote, above the maximum federal limit on out-of-pocket costs commercial health insurance plans can impose on enrollees for essential health benefits. So what are essential health benefits? They are a set of 10 categories of services health insurance plans must cover under the Affordable Care Act, the ACA. As you can see, prescription drug coverage is on here, but that is ambiguous as Trikafta is considered a specialty medication. That means that some insurance plans or companies might not even have it on their formulary. Their plans might not even cover it, and that would mean a patient would have to pay for it themselves. Per my own personal conversation with my Vertex representative, she stated that there is no requirement for insurance plans or policies to qualify Trikafta specifically as an essential health benefit. In fact, she actually encouraged me, and it was one of the questions they gave me to ask my insurance plan, will you be considering Trikafta as an essential health benefit? So my understanding of this essential health benefit is how they're classifying Trikafta, because the ACA says that prescription medicines should be covered. Honestly, my rep was really kind of all over the place with this, and it felt like they were reading from a script when I asked questions. But this is how they're justifying lowering their copay cap, is because they are saying Trikafta is this essential health benefit, but yet insurance companies and plans do not have to qualify it as this. There's no requirement to do so. My rep told me that because they're classifying internally at Vertex Trikafta as this essential health benefit, they're, in theory, under this, if Trikafta is classified as an essential health benefit, should be a $9,000 out-of-pocket max for individual insurance plans and an $18,000 out-of-pocket max for a group plan per the ACA. So patients would have to pay either $9,000 or $18,000 out-of-pocket, was how she explained it to me. So to recap that, Vertex is basing their new copay assistance cap on the premise that insurance companies will qualify Trikafta as this essential health benefit, even though there is no requirement to do so anywhere. But it still gets a bit more complicated. So in addition to this essential health benefits requirement, we'll say that Vertex is implementing or pretending Trikafta is going to be, there's also going to be the factoring in of something called copay accumulators and copay maximizers. An important note before diving into this, many states, but not all states, have already banned copay accumulator programs. These bans, however, only apply to state-regulated plans like Medicaid, Medicare, Marketplace, and very few employer plans as well. This graphic behind me is specifically from Vertex, but I did additional research onto what these programs are. I will show you it in a minute. So accumulators, these programs don't allow copay assistance dollars to count towards the annual deductibles and out-of-pocket maximums. This means that after the maximum value of the manufacturer's copay assistance card or program is reached, patients have to pay the remaining cost of their refills or full deductibles. Maximizer sets an individual's cost-sharing amount to be the maximum value of the manufacturer's copay assistance program applied evenly throughout the year. This assistance does not count towards a person's deductible or out-of-pocket expenses either. So an example of the maximizer is if the manufacturer offers $12,000 a year in copay assistance, in theory, that maximizer will then set your copay to be only $1,000 per month, and the assistance card will cover the full amount for a year. So why are these programs being implemented? Agreed. But the official answer is, in response to rising healthcare costs, copay accumulator programs shift more of the cost burden to policyholders who, as a result, have to pay more for their treatments out of pocket. Patients with an accumulator or maximizer as part of their health insurance plan will only receive copay assistance of up to $3,500 per month, down from the $8,950. Side note, when I reached out to my insurance company about accumulators and maximizers, they had no idea what I was talking about, and I've heard that from several other people as well. Vertex does state that if your insurance doesn't have an accumulator or a maximizer program, they will continue to give you the $8,950 per month, but a few things. My conversation with them on the phone, they never mentioned this. They told me that they had paid $79,000 this year alone for my medicine, and that was hard news for me to hear. Several patients I know currently have copays higher than $8,950, and even with the assistance, they're still struggling to afford their medication. And possibly the biggest thing is not everyone qualifies for this assistance program. Some people just literally don't get assistance from Vertex and have to figure out paying these high copays. Some people end up getting a divorce and don't have insurance coverage, or they don't have insurance coverage for a number of reasons and they don't qualify. There's a number of different reasons, but I've had many people reach out to me and say they do not qualify for their assistance programs and they are stuck with these incredibly high copays. So regardless of the changes that Vertex is making to their copay assistance program, there are still people who have very high copays that don't qualify for this assistance and just can't afford the medication either way. And then there's people who qualify and they still can't afford it. So that is the overview of this. I have gotten some common questions and other things I'm going to go through quickly.